Let's pretend these are your muscle fibers. Okay? You only have 3, but they're really good, I promise. Okay. So let's say you got, let's set this up pretty good. Something else. Okay. I'll just use my pec for now. Okay. So let's get down to knots here. So let's say this is just one strand of your pectoralis major. Let's just say this is one strand of, we have 3 muscle fibers. Each of these are their own individual muscle fibers. And inside of each of these muscle fibers lies 2 different filaments, or fibers, as well. Myosin 1 and actin. And these are what really comprise your muscles of their contract and relax capabilities, what makes us able to move in any which way that we want to. And whenever you go to a massage therapist to get all your muscles checked out, and if you're feeling tight, or if you have what you think is a knot, and what they might even say is a knot, let's try to get down to that word knot. Let's really expound on that. So a knot is whenever something is literally bound up like that. Right. So that never happens inside of your muscle fibers. What happens is your muscle fibers, whenever they contract and relax often enough, and you don't give them enough time to relax, they just lock up on you. And then all of a sudden, you have this tension where you never had a tension before. And that's because you have myosin and actin, which are these finger-like projectiles, filaments, inside of your muscles. And they kind of work like a cog does, where they kind of interlace and intersect until they form a nice cohesive bond like that. And they have very, very, very high tensile strength. So trying to literally pry them apart, like with a deep tissue or with somebody's elbow to ram it through, doesn't really work very well. In fact, it damages the muscles more than it does help them. So that no pain, no gain, is an outdated saying, let's say, for massage therapy at least. So whenever they get locked up like this and very adhesed to itself, what a proper massage therapist, what somebody can do, anybody can do, but a massage therapist probably could do it the best, is to literally try to take the muscle and lengthen it back out very slowly and steadily until finally all of these fibers that were all kind of jumbled up and didn't want to relax can finally be worked out until it's all straight again. Alright. Alright, you know, we'll just keep going with this. Okay. So yeah, that's something that really isn't needed. Knots are not something that you can really just deep tissue just wick away with a nice elbow in there. That's something with a more ischemic contraction is needed. It's something where you need to force the blood out of that area and to force blood back into it very quickly, which is just like the trigger point where you just kind of press on it. And the key is to keep within about level 7 if you're going to go on from a 1 to 10. But there's plenty of tricks to get those things out, to get the knots out. But the best and most easy way is probably just to do a nice long fluid stroke from origin to insertion on the muscle. Alright, well that wraps up the video, fellas. If you guys have any comments, or if you feel like anything I said on here was wrong, I'd be free to discuss any kind of opinions you have. Just leave a comment below. Don't forget to like and subscribe.